Hello students. In this video, we will talk about the future directions in nursing informatics. When we talk of the future directions of nursing informatics, we pertain to the 21st century scenario of our healthcare setting. Now, in the 21st century nursing, more information is definitely available to all nurses. This means that if we have more information to manage, the more that we rely on technology to manage this information. And also, in the 21st century healthcare setting, there are more ways to identify the causes of your diseases, making our information database diverse and wide in scope. And also, genetic profiling is used, no, to have a profile, no, for a specific population, and that there are laws that are promulgated to accelerate nursing informatics. And also there should be an access in the which demands or which deems it necessary to have EHRS on different parts of the globe. Now, always remember that that information technology, as always has been driven by this number one factor, which is the assurance of patient safety. It is always patient safety that drives healthcare innovation and information technology innovation in our practice or in our profession, to ensure that the patient will always be safe in every process of our healthcare. And also, the rising cost of healthcare also deems us to be more efficient in giving our care. And to be more efficient, we utilize information technology. Now, the downtrend or the downside of having or using information technology and technology itself in healthcare is the decrease in labor. No? If computers and technologies are replacing the actual labor itself, it means that there's also a decrease, no, in the labor demand for nurses. No? But now, even now, that has yet to be proven, because right now there's still demand for nurses, no, in any part of the world. Now, we also want to shift the focus of our care from hospital to community. No? We give prime now to community-based care, because we want to treat the patient, no, at a more decentralized setting. Okay? And when things get decentralized, to monitor it, we need technology. We need to implement technology to it. Okay? Even the complexity of medical condition drives us to use information technology in healthcare and nursing, and as well as the deficiency in public health reportings, no, which is evident in our contact tracing, no, here in the Philippines when it comes to COVID-19 exposure, and also the competition in the business of healthcare. Okay. So here's an innovation, the first innovation that has been initiated in the United States, no, which is your HITP. They call it HITP, or the Health Information Technology Plan, where they wanted to accelerate the identification and adaptation or adoption of standards of safe and secure sharing of health information. Okay, by increasing funding for modernizing the electronic health record system and granting incentives and opportunities that encourage healthcare providers to use electronic medical records. So sa makatuwid, in the United States, to encourage healthcare practitioners to use information technology, they provide the infrastructure and they provide the incentive, no? So that they'll be encouraged, they will be encouraged to do or use electronic medical records. The trends towards 2030, definitely there will be more monitoring or surveillance of demographics, patient demographics, because of the number of aging population, the growth in chronic disease, no? Now, uh, if we are going to monitor the demographics of the people, therefore there should be quality, no? Focus, no, on quality of informatics, no, in terms of healthcare. Another trend that's being observed, no, in the 2030 go towards 2030 is the implementation of security and biodefense, okay, which is to protect, mitigate, respond, and recover from acts of bioterrorism. No? This includes implementation or adoption of technologies that will be required to prevent, detect, treat, remediate, and attribute acts of terrorism due to biological agents. Okay, they learned from the 9/11 attack. Even though it's not a bioterrorism attack, it is a terrorist attack. No, where they learned that the number of that their surveillance system for emergency medical treatment is not coordinated. So they learn from it, and they develop, no, their system, their health system, to respond, no, to terrorist attack and even bioterrorist attacks. Okay, so they also develop preparedness planning programs, no, data standards that are specific, no, for biosafety and security. Okay, and also information security assurance. Ibig sabihin, the assurance that the data, the health information data, or the health information of the patient will be kept secured. Another focus or trend toward 2030 is genetic revolution, no? Wherein they use gene mapping and gene profiling to determine drug effectiveness. Okay, because they want to simulate this profile with the effects of the drug, no, to minimize the need uh, for for the side effects of human trials. Okay. Another trend is the use of nanotechnology, which refers to the detection, no, recognition of diseases, no, at the molecular level. No? When you identify daw kasi a disease at the molecular level, at the start from its development, no, when you recognize the protein structure at the early stage, no, you are trying to identify the disease at an early stage, and therefore act quickly to resolve the disease. So that's in a sense the use of nanotechnology in healthcare setting. So that would be all for our lecture for this week. If you have any questions, you can always ask me a question through my messenger account. Okay? So I hope you have learned something from me, and I wish you a happy week.